Thank you. Okay. Good afternoon, everyone. Welcome to the March 24th Electronic Visit Verification Public Meeting. We're going to give it another minute or so to allow people to still join, and then we'll get started with this afternoon's presentation. Okay, good afternoon, everyone. Welcome to the Friday, March 24th, 2023 Electronic Visit Verification Public Meeting. My name is Janice Bickle, and I work for the Department of Human Services in the Office of Long-Term Living, and I will be starting off today's meeting. Okay, as a reminder, all phone lines are muted. We encourage you to submit any questions and comments through the chat feature. Make sure you reference the slide number that you're talking about in your questions so we can use that to provide an answer. We're not going to be taking questions live this session, but as through our listservs, we gave the option of submitting questions to the RA box before March 15th. So questions that were submitted to the RA box before March 15th will be read and answered at the end of this session. And then any questions that are submitted through the chat box, we will compile into an FAQ and post on our website. So just a reminder to reference the slide number in your question or comment, and that'll make looking up things easier for us when we go to research your question. Okay, today's agenda, we're going to do a back to the basics overview of electronic visit verification. We're going to give an update on our implementation of electronic visit verification for home healthcare services. And that'll include an introduction of the new error status codes, or ESCs, for home healthcare services. We're going to give you some reminders and updates about electronic visit verification. We'll do some updates from each program office. As always, we have our EVV contacts, who to call at the department, who to call at Sandata, who to call at HHA Exchange. And then at the very end, we're going to have the submitted questions read and the answers provided, and then we will end today's session. So just an overview of electronic visit verification. We are doing this because it is a federal requirement as part of the 21st Century Cures Act. And the 21st Century Cures Act is that federal requirement that requires each state to have an electronic visit verification system. Now, that visit verification system is going to verify the type of service provided, the individual receiving the service, the individual providing the service, the date that the service occurred, the location of the service delivery, and then finally the time that the service began and the time that the service ended. So just to break it down a little bit further, what the federal law requires is that each EVV system automatically capture the date of service. And then if you are using the SanData Mobile Connect, that's captured automatically. If you're using telephony, which is a telephonic visit verification, that information is captured automatically as well. The federal law also requires the capture of the start and end time of the service. Now that is captured automatically in the mobile app and is also captured automatically in telephony system as well. The law requires the type of service. So when you go to log in, you might have to select that on the app, or if you're using the same service consistently, it'll probably already be there for you to select in the mobile app. And then if you're using telephony, you probably have a service ID to enter if you're a caregiver. So the law requires the location of the service. The Mobile Connect app is going to capture that GPS coordinate at the service clock in as well as the service clock out. And again, that's captured automatically in the app. And if you're using telephony, that's automatically captured by the phone. So the federal law, the 21st Century Cures Act, requires the EVV app record the individual receiving the service. So if you're going into the Mobile Connect app, the caregiver is going to enter the client identifier as part of the clock in and clock out. And if you're using telephony, that's going to be captured automatically. Finally, the requirement is to capture the individual providing the service. And if you're using the SanData Mobile Connect, you're going to have the caregivers log in already there for the app. And if you're using telephony, you're going to use the ID entered by the caregiver. Okay, so we're going to walk through just an example of a general EVV visit. So if you have your caregiver scheduled and it's the date and time that your caregiver is scheduled to perform the service and they arrive to your home or agreed upon spot in the community, that's where your EVV visit begins. So the caregiver arrives, and next the caregiver is going to use the mobile application or a telephony system to check in, and that's going to capture the client ID, the caregiver ID, and the GPS coordinates of where they are beginning the service, as well as the type of service being provided. So then your caregiver works through their shift and provides the services. At the end of the shift, the caregiver is going to use either the mobile application or the telephony option to check out. And then if there's any process skipped throughout that, so if your caregiver forgets to clock out at the end of the shift and realizes the next day, that would be an incomplete visit and a correction will be needed. So if a correction is needed, the provider agency administrator is going to have to log into the web portal and make a correction to the EV visit in order to have it be corrected. And then verify that all information that is needed for that visit has been submitted. Next, the data can be submitted, and there's going to be a standard claim or encounter billing and promise. So that's a general overview of the EVV process. Okay, so this is what our systems look like. In the middle of our open model, you have the DHS aggregator, and all of our systems feed to the DHS aggregator. So you have in the greenish bubble is the DHS SANdata EVV system. In the bluish bubble is just a call out for our HHA exchange, which is an alternate EVV system that a lot of the community health choices and physical health choices MCOs are using. So the DHS SANdata EVV system, that feeds to our DHS aggregator. And then HHA exchange, the information collected through that is submitted and fed to the aggregator as well. Our fiscal employer agents are using an alternate EVV. That data is collected through their systems, and that is submitted to the DHS aggregator. And any other alternate EVV system that is approved by SANdata and the department can be used, and that information is collected, that is submitted to the DHS aggregator. The DHS aggregator information is read-only, and then that corresponds and goes back and forth to our promise system. So when an EVV service is on a claim in promise or a claim transaction, the claim is validated against the EVV visit data in the DHS aggregator. So you need both of those to agree in order for a claim to be successful. Okay, so we've had a question come up across several entities about participant cell phone use. And the question is typically, are caregivers permitted to use a participant's cell phone for mobile clock in and mobile clock out? And the answer to that is that DHS does not prohibit the use of a participant's cell phone for electronic visit verification. A participant's home phone, cell phone, or a smart device may be used for clock in or clock out if the participant has agreed to its use. The Community Health Choices Managed Care organizations can implement additional criteria to meet minimum requirements of EVV. And our CHC and physical health MCO, or our CHC providers and physical health providers should consult with the MCOs to see what the MCO's EVV requirements are. Okay, now I'm going to let Ellie take over, and she is going to give us an update on home health care services implementation.
Hello, and we can go to slide 10. The 21st Century Cures Act mandated that states implement EVV for home health care services by January 1st, 2023. Pennsylvania has applied and been approved for a good faith effort exemption, which will expire December 31st, 2023 for home health care services. The soft launch period began August 10th, 2022. This means that home health care services EVV error status codes are setting, but are in a pay and list disposition prior to January 1st of 2023. For claims that contain home health care services during this time, MMIS will perform validation against the EVV aggregator to determine if the information submitted on the claim matches the EVV personal care services visit data stored in the EVV aggregator. However, EVV error status codes will sit without impacting claim payment. During this period, the claim will continue to successfully pass DHS EVV validation and process through the normal claims adjudication process. As of January 1st, 2024, claims will be impacted. The department published the list of Medicaid state plan and waiver services identified as home health care services that are subject to EVV. This list is available on the DHS EVV website at the following website link: Medical Assistance Bulletin number 052209, as well as several others that are listed there. for electronic visit verification requirements for home health care services in the fee-for-service delivery and managed care delivery systems was issued on August 10th, 2022. This bulletin applies to OMAP, ODP, and OLTL and is available at the following website link. Error status codes used in home health care services for EVV. Error status code 935, EVV home health care services visit verified. Error status code 936 means duplicate matching EVV home health care services visits are found. Error status code 937, home health care services units billed exceed the units verified in EVV. And error status code 938, no matching home health care services EVV visit found. And back to Janice.
Okay, thank you, Ellie. We're going to go over some reminders and updates. Okay, some EVV compliance reminders and tips. In order to validate if your visits are verified or if they need corrections, all DHS aggregator users should be logging into and checking the DHS aggregator to ensure that completed visits are in a verified status. That's what we're looking for, is a verified status. Claims will fail if EVV validation, if the visit is not in a verified status. So DHS EVV users in the SANDATA system should check their DHS SANDATA EVV system. If you're using HHA Exchange users should validate the visits in HHA Exchange. Because again, back to that chart that had the DHS aggregator as that square, as that rectangle in the middle, all those systems feed to the DHS aggregator and information is read-only in the aggregator. So if your agency is using a combination of these, such as HHA Exchange for your community health choices visits and SANDATA free system for your fee-for-service visits, then you will need to check both of them regularly. And again, that reminder that the DHS aggregator is read-only. Okay, SANDATA releases. SANDATA will be communicating via email to provider agencies when staff need to log out because of a system outage. Providers should review notifications prior to releases and inform their staff when they will need to be logged out of the system because of a system outage. And the SANDATA customer care portal is accessible to find any release notes, and it's available on the link on this slide. Okay, EVV system reminders for personal care services. Providers who are using the DHS EVV system should remind their direct care workers to update the SANDATA Mobile Connect or SMC application after a SANDATA mobile application release. Provider staff are to communicate with their administrators on issues with that SANDATA Mobile Connect or telephonic visit verification or TVV. EVV administrators should reach out to the Provider Assistance Center only when they can find resolution to a SANDATA Mobile Connect password reset. And we definitely recommend that all agencies that are using the DHS EVV system have at least 2 EVV administrators on staff in the potential event of a primary administrator's unavailability. Okay, we're going to talk about manual edits and compliance rates. The department is continuing to look at information in the DHS aggregator and continuing to perform targeted outreach to provide technical assistance to providers that have either not submitted EVV data or have a high percentage of manual visits. That can be manual entries or a high percentage manual edits. The EVV compliance report is currently available in the DHS EVV aggregator. This report allows providers to efficiently determine their quarterly compliance percentage. And we went over in the previous public meeting how to access the report in the DHS aggregator. So that information is available on our DHS EVV website. Providers should self-monitor their EVV compliance using the reports available, and they should work to improve areas of non-compliance. A reminder that DHS will be reducing the manual edit compliance rate threshold in the future. And at this point, we're not sure what the number is going to look like, but we are starting to work on an updated bulletin to reflect a new manual edit compliance rate. So there could be financial repercussions in the future for a high percentage of manual edits and manual entries and manual entries for EVV visits. So as a reminder, all caregivers, that is agency model, as well as direct care workers who work for participants who self-direct their care, they should only be using a manual entry on an emergency basis. This should not be the norm. EVV visits are expected to be entered in real time to accurately collect all the information needed for the visit, which includes a real-time clock in and clock out, as well as GPS location capture. Those are all those data points that are needed to be collected in order for our state to be compliant with the federal EVV requirements. So any entity who is found to consistently not comply with EVV requirements could have adverse actions in the future. So another manual edit compliance contact reminder, we're reminding all provider agencies to ensure that their information is updated in all DHS systems in order to make sure we can contact you. We've had some questions come across specific to location capture. And our question is, what is the specific requirement for location capture? And the answer to that is that the EVV requirement is that the location be captured electronically. CMS requires verification of location at the start and end of a service. GPS coordinates, which are latitude and longitude, are required for both the mobile and fixed visit verification, or FVV devices. Location is not tracked throughout service provision provided in the community. The location should be captured when a caregiver arrives at a participant's home and the shift starts and they clock in order to assist with grocery shopping out in the community or whatever the case is. And then again, after they return from a visit into the community. So please note that 0.0 is not a valid latitude and longitude value that will be accepted into the EVV system. The GPS coordinates will be captured in the DHS SANDATA mobile application during check-in and check-out. The perimeter for locations is set at 1/4 mile in the DHS EVV system. However, even if the recorded location is outside of that quarter-mile perimeter, this will not cause an exception in the DHS Sandata EVV system. So a provider will be able to enter multiple addresses where services are provided for a participant, and these addresses can be updated as needed. If an error occurs, any system errors may be corrected through the web portal by that agency's EVV administrator. Okay, another question specific to location capture. What is the specific requirement to capture location for telephony? And the answer to that is telephony requires the originating phone number and telephony PIN. As such, telephony may only be used with a landline. Okay, now we're going to go to program office updates. And we're going to start with the Office of Developmental Programs.
All right. Thank you, Janice. Next slide, please. All right, continue with Janice's theme about manual edits. ODP has incorporated EVV manual threshold compliance into their ODP claim documentation review process. This is very important because ODP, as you know, goes out through the does their monitoring through the quality assessment and improvement process. So for providers, you need to be ODP providers, you need to be very, very aware of the quality improvement process. And one way to do that is to understand that process is to click on this bulletin here if you have a chance and understand the documentation review and what we're looking for. So this bulletin provides guidance and documentation needed to substantiate a claim and provides guidance on the service documentation where the process and the guidance that we're looking for providers. So we just want to remind providers that this is one way we're evaluating the EVV threshold. There's other ways we're going to be looking at it, but it's very, very important as we're doing reviews that you have your service notes and your progress notes to substantiate the claims, and this guidance here will help for you to do that. So, okay, Janice, next slide, please.
Okay, now I will provide the Office of Long-Term Living update. Okay, OLTL is still seeing a high percentage of providers who are not meeting the compliance threshold for manual edits, which is again currently at 50%, but we're looking to increase that. As a reminder, a provider's manual edit threshold percentage is based upon that agency's fee for service, which would be the OBRA waiver and Act 150 clients only. So agencies who are providing services for both community health choices as well as fee for service clients should closely monitor their fee for service visits, because fee for service clients are typically fewer, which can impact a provider's manual edit percentage. And the DHS, the EVV compliance report in the aggregator is going to show all visits for your provider agency, meaning community health choices as well as fee for service. Visits within this report cannot be filtered by payer. Okay, now we're going to hear from Bureau of Fee for Service from OMAP.
Good afternoon. The Bureau of Fee for Service program is encouraging all home health care service providers to start requesting their direct care workers to get familiar with calling in to EVV for home health care services. We are noticing a high volume of claims that are hitting against the 938, meaning there's no match found in EVV. And we just wanted, to reiterate that effective 1/1/2024, home health care service claims will result in a denial if there is no matching service found for the home health care service in EVV. We also just wanted to remind the providers, if you have any questions regarding any EVV claims for fee-for-service clients, please contact us at the resource account below. Thank you, Janice.
Thank you, China. And back to the Office of Medical Assistance Programs, Bureau of Policy Analysis and Planning updates. Federal regulations prohibit Medicaid payment for personal care services provided by a parent or legally responsible relative. Even though the department pays home health agencies, CMS considers parents working for agencies to be paying parents. The department receives CMS approval through an 1135 waiver to pay parents and LLRs to provide PCS to their children for the duration of the public health emergency. This authority ends on May 11th, 2023. The department began looking at ways to continue to allow paying parents and legally responsible relatives as caregivers beyond the end of the PHE. On December 13th, 2022, the department met with CMS regarding solutions, and on February 3rd, 2023, CMS provided guidance that paying parents and LRRs can continue under the home health benefit as long as aides meet federal and state requirements. In the near future, the department will announce that all new requests for pediatric shift care services rendered to medical assistance beneficiaries by home health aides will be classified as home health care services. A new procedure code will be established for these services, previously provided as personal care services, using procedure codes S9122 and T1019 that will be considered home health care services for both the fee-for-service and managed care delivery systems. The department will issue a bulletin and publish a notice announcing the new procedure code and effective date that home health agencies will use to bill for newly designated home health care services after the public health emergency ends. The department will issue a bulletin announcing the effective date that providers must adhere to the home health care services electronic visit verification requirements bulletin for new pediatric shift care service requests. The department will provide guidance to MAMCOs regarding their role and responsibilities regarding pediatric shift care services at the end of the public health emergency. The department will submit a state plan amendment to CMS to add pediatric related language to the home health care services section of attachment 3.1A and 3.1B. The department's guidance and updated code lists will be posted to the EVV webpage. Providers are encouraged to check the department's website for updates at the provided link. The department is looking to develop a new home and community-based services or demonstration waiver to, in part, memorialize this change in services.
All right, EVV contacts. All right, for EVV contacts for technical issues such as DHS and data account assistance, welcome kits, account unlocks, issues for DHS and data EVV, please contact Provider Assistance Center at PAC1 gainwelltechnologies.com or at 1-800-248-2152. For issues related to HHA Exchange and CHC billing, please contact HHA Exchange at support@hhaexchange.com and or the appropriate CHC MCO. Vendors needing to integrate with the CHC MCO HA Exchange should contact PA Integration at hhaexchange.com. For issues related to PH MCO claims and billing questions, please contact the appropriate PH MCO. All right. For alternate EVV vendor contacts, new home health care services, FFP for service providers who have completed and submitted the new provider enrollment form by the DHS alternate EVV webpage and have questions specific to alternate EVV can contact the SunData alternate EVV support team. For issues related to alternate EVV, such as an account unlock, issues for the DHS aggregator portal, integration status inquiries, and issues with the DHS aggregator accepting file submissions, please contact, the contact information is as follows. Phone number 855-705-2407. And the email is pa@evvsandata.com. All right, for EVV contacts, for general EVV program issues or requests to be added to the EVV listserv. Now, this is very important. If you want to get information from, what's going on with the EVV, you need to sign up for this. So please contact EVV resources account at pra.pwevvnotices@pa.gov. Providers with technical issues reaching out to SunData. Sorry about that. Providers with technical issues reaching out to PAC or SunData alternate EVV team may copy DHS on those emails at the following email address: ra-pwevvissues@pa.gov. And providers with support tickets numbers they wish to escalate with DHS should reach out to DHS at the following email address: ra.pwevvissues@pa.gov. So if you want us to be on an email if you have technical issues and you're contacting SunData, it's important for the state to know that you're reaching out to SunData. You probably should want us to know about it and copy the EVV mailbox as well. All right, next slide, please. All right, DHS EVV provider resources again. SunData EVV customer service care portal, SunData on demand. This website is www.sundata.sundesk.com. And SunData EVV training video library is at that link below that. I'm not going to read that one. So, and then SunData Learning Management System for administrators is sundatalearn.com. And then DHS EVV webpage, there you have it. It's on the dhspa.gov website. And there you have some great resources underneath there. You have the DHS EVV SunData training manuals. You have the DHS EVV medical assistance bulletin. You have a lot of our frequently asked questions on there. We have a ton of them on there. So it's really, please go to the website there before you go to the, start submitting your questions to the EVV links and stuff like that, the resources accounts, because most of the time your questions already been answered. We have EV up and running for a few years now, and most of these questions have already been answered. So please, again, visit these frequently asked questions. And of course, we have the ODP EVV technical guide on that website. So. Okay, for billing issues such as why EVV ESCs are setting, what the EVV error status code mean, questions about what is the aggregator, please contact the following program office claims departments. ODP claims resolution section, there you have the number, 1-866-386-8888 and the email address and the hours of operation. You also have the OLTL provider call center at 1-800-932-0939 and their hours of operations. And then you also have the OMAP provider inquiry line. So 1-800-537-8862. Again, remember what program you're serving and who you're serving, so you know which party to call on your claim issue. All right, we're going to go to Janice, who has a few questions, and she's going to go to the question and answer session. Let's give her a minute.
Okay, thank you, everyone. We're going to pull up an additional slide, and we're going to have the EVV Public Meeting question and answer session. So questions that were submitted to the PW EVV notice email box before March 15th are going to be read and answered here. We received about 5 questions, and that was from 2 people. So we're going to go ahead and read the question, and we're going to answer it here. Okay, so from Tyree Smith, the first question we received was, if participants are not bed or homebound and can go into the community with caregivers, why is it mandatory to clock in and clock out in the home and not also in the community? And the answer to that is only telephony users would require clock in and clock out at the home because it uses the client's landline. That's the only reason they're bound to that. Okay, we have another question from Tyree Smith. And the question is, will there be repercussions for not following clock in and clock out guidelines? I have lost caregivers because they said they know other agencies who don't follow the guidelines as we do. So the answer to that is that DHS is monitoring all agencies. And we're also monitoring the managed care organizations for compliance with EVV requirements. Okay, a third question that we received from Tyree Smith is, what is the maximum number of missed EVV GPS verified clock in and clock outs? Is it 50%? Is it 60%? Is it going to increase over time? And if so, when? Okay, the answer to that is current DHS policy is that providers should have at least 50% of their EVV visits electronically verified, meaning that there's no manual entry and no manual edit to that visit. This requirement will be increased over time so that the majority of visits are expected to have no manual edit and no manual entry. And DHS will communicate with stakeholders when the requirements are changing. So again, as we've pushed in this meeting, we've been doing EVV for PCS for a long time now, so we should be pretty good at figuring out what the initial problems were, and everyone should be in a pretty good rhythm where any manual edits and entries should be the exception, and they should definitely not be the norm. Okay, another question we received from Tyree Smith. Is there a standard from the state regarding EVV that MCOs must adhere to? I don't think one MCO is fully abreast on EVV, and many questions go unanswered by their employees, including supervisors and network managers. And the answer to that is that MCOs are required to adhere to DHS EVV rules and regulations. However, the MCRs are able to implement additional criteria to meet the minimum requirements of EVV. So providers should consult with each individual managed care organization on what their EVV requirements are. Okay, our last question we received is from Hunter Hogan. Medicare, Medicaid dual plans are singular plans with both Medicare and Medicaid components. For example, there are Geisinger dual plans that will cover 100% of costs associated with home care. So that would be 80% on the Medicare side of the dual plan and 20% on the Medicaid side of the dual plan. However, this is processed all through one singular plan. There are multiple other states that have advised that these dual plans will need to be EVV compliant. CMS has confirmed that they have deferred this decision to the individual states. That being said, will EVV compliance be required for patients that carry these dual plans in Pennsylvania? And Hunter, the answer to that is claims and encounters submitted to Pennsylvania Medicaid, which were primarily processed and paid for by either Medicare or a Medicare Advantage plan, are not submitted to EVV processing in Promise. Since EVV is a federal mandate, the EVV validation is performed by Medicare or the applicable Medicare Advantage plan. However, claims and encounters submitted to Pennsylvania Medicaid, which do not have any cost sharing with Medicare or a Medicare Advantage plan, would be subjected to EVV error status codes in Promise. So that is our last question that we received in advance of the meeting through the RA box. And we appreciate everyone's time and participating in today's EVV public meeting. If you submitted any questions or comments in the chat feature, we're going to take them back and compile an FAQ with any new information that we can post to our website. And then in the future, any additional planned EVV public meetings will have the information for them submitted through any listservs or through that PW EVV notice. So we want to encourage all people to sign up for listservs through their program office, as well as the EVV specific listserv, which is that RA-PW EVV notice at pa.gov. So thank you very much for participating in today's meeting, and we look forward to seeing you at the next one. And thank you, and have a good weekend, everyone.